Hello, welcome, and thank you for joining us today for this Hopkins at Home discussion, In Conversation, a discussion on the mental health crisis in school-age children. My name is Christopher Morphew. I serve as Dean of the Johns Hopkins School of Education. It's an absolute pleasure to host this two-part conversation today where my colleagues, Dr. Elise Pas and Dr. Jodi Miller, and I will discuss the current adolescent mental health crisis in America through the dual lenses of public health and education policy. The first portion of our conversation will focus on defining the scope, scale, and current landscape of this critical issue, and the second portion will address the intervention strategies for parents and educators facing these challenges daily. I will be moderating our in-studio conversation with the two experts here with me today, Dr. Jodi Miller and Dr. Elise Pas. Dr. Jodi Miller is a postdoctoral fellow and graduate of the School of Education. She's currently in our counseling department in the School of Education. Her research focuses on how stress affects students' abilities to thrive and ways schools can help support young people who may be struggling. She also studies the importance of student and teacher well-being for promoting better outcomes. Jodi's also the founder of Wellcheq, a web-based app that enables students to complete a quick daily check-in and provides educators with insight into the needs of their learners. Her work is inspired by her experience as a high school biology teacher in Philadelphia. Dr. Elise Pas is a research professor in the Department of Mental Health within the Johns Hopkins Bloomberg School of Public Health. She's a trained school psychologist. Her research, teaching, and practice goals are to promote successful dissemination and implementation of evidence-based preventive interventions across the public health continuum in K-12 schools. Much of her research seeks to understand the needs of youth, how best to support educators within schools, and what is needed organizationally to allow such effective practices to be utilized. She also has a long history of contributing to randomized trials to determine if specific approaches or interventions are effective at promoting positive student social, emotional, behavioral, and mental health development. With the introductions out of the way, this is a good place to start. I'll start with you, Elise. Could you talk a little bit about defining the current state of mental health for adolescents?
Yeah.
And are we in crisis?
That's a great question. I mean, the U.S. Surgeon General released a report in 2021 saying, yes, we very much are in a mental health crisis for adolescents in particular. There are many ways that we look at this and get data about mental health in our society, and undoubtedly the numbers are going up. About 1 in 5 school-age children are suffering for some sort of mental health diagnosable disorder. When we look at more alarming statistics that can tell us what's happening with mental health, specifically depression, we see raised rates of emergency department visits for mental health crises. We see greater suicide deaths. That's a trend that's happened kind of leading up to and into the COVID-19 pandemic in 2020. So yeah, I think by all accounts, there are many aspects of this that we are in crisis, or our children and our youth certainly are. And I think what's really important to think about is the different types of mental health disorders that emerge at different stages in development. When we think about schools specifically, there are some like more of the attentional, like ADHD, the attention deficit or hyperactivity disorder, anxiety you'll see with our younger kids in an elementary school perhaps. But then as kids are getting older, we see a greater emergence of some things like depression, other anxiety, more behavioral disorders. So there's a lot that's happening, and there's a lot that's being brought into our schools.
And I think what's also really hard is we're seeing these specific data about suicidality in emergency departments, but we also have students who just have compromised well-being, right? It's not necessarily a diagnosable issue, but a lot of our students are just not feeling particularly well. And so thinking about more globally, how do we support people who have these diagnoses, and then, but also just how do we generally raise emotional well-being for all of our students who are experiencing a lot of different stressors than maybe they didn't 3 or 4 years ago, but more broadly than we all have experienced in the last 10, 15 years.
That's right. I mean, we'll get to the factors that relate to this, but one of the things you already raised are these stressors that all of us are undergoing and feeling. And so it's really important to bring up that point because it's easy sometimes, certainly in the space of psychology, to think in like a disorder language, but really it's a continuum, right? All of us have anxiety at some point. Actually, anxiety is a great thing for us in our regular life. It's what stops us from walking into the street when a car is coming. But but when we get to that disorder space, what that really is about is that is something that's disrupting my daily functioning. That's really disrupting my life. That's how we diagnose a disorder. But, thinking about the full spectrum is really important when I think about that too. So I love that you raised that because it's really about well-being more broadly. And I would say that's an obvious symptom that well-being is a big problem for our kids. But there's many other people whose well-being is also compromised.
So you mentioned the continuum, parents of adolescents, particularly maybe if it's their first child, the line between sort of normal development and anxiety, depression that actually needs to get treated. How do parents understand that?
Yeah, it's a really hard question. I think that's what a lot of parents, really highly educated parents in one space, they don't have this knowledge. And so I think about the experts that you're interacting with in your regular life as a parent, a pediatrician. I think pediatricians have been an interesting space. They aren't necessarily always prepared around mental health, but many, many more are becoming so. And there's a big push in medicine to get there. So that's a good expertise. There are some great authors out there that write in this space specifically on adolescence. I know there's a great book focused specifically on adolescents and girls called Untangled. And one of the things that the author, Lisa DeMoore, does in that book is she actually has kind of normative things that you'll expect to see that's difficult and challenging, and a section in each chapter when to worry. But some of this is, I think a lot about this idea of how do we get knowledge out to everybody, and that's one of the challenges a lot of parents face. Even my own networks of people are come to me because they don't know where else to go, and that's a major challenge. So you bring up a great point of how do we really navigate this? The other place is school.
Yeah.
And that's where increasingly we'll talk about this more in our second segment about what can schools really do. But the school can be a hub for information, I think.
And you have the benefit of school counselors or social workers in almost all schools, especially middle and high school. We're seeing not always as many in elementary school, depending on where we are in the country, but they're a great resource, and also teachers. And I say that not that teachers can necessarily diagnose or solve anything, but they're the ones who are spending a lot of time with your children and can identify some of these issues. Because what we've learned for so many young people is that it's just really hard for adults to know how they're feeling. And that's okay. As parents, as teachers, whomever, you don't have to necessarily guess. Sometimes help just asking is a great place to start, because we think we know, especially if you're a parent, because this has been your child you've raised forever, but these are complicated issues, and it takes a village, and it's okay to lean on other members of the village.
And talking about schools and teachers, compromised mental health, there's a lot of focus now in schools on social emotional learning. So teachers are now getting trained to understand, manage that. What you do a lot of work with schools, with teachers. Could you talk a little bit about that?
Sure. So I think there are a few different things happening. So one, and we'll talk about this a little bit more in the solution, is curriculum and bigger school-wide programming. But there's also conversations about relationships. How do we build stronger relationships with students and teachers and students with each other? Because that's going to be a big part of helping our young people kind of navigate the tumultuous time that is childhood and early adolescence and further adolescence. And so how do schools help bolster relationships with students and their teachers and peers and build this sense of community? Because when young people have a sense of belongingness, it really helps them kind of navigate some of the different challenges that are just inevitably going to come their way. And we also know generally that when students feel like they belong, their well-being is better, they're less likely to experience depression and anxiety. So I think that's a really great place to start. And then also we see too conversations about coping and thinking about how do we use schools as a place to help students. And we'll talk about this more, like I mentioned, but think about what are our strengths? How do we kind of overcome challenging times? How do we support one another? How do we remain hopeful and optimistic and in what can feel like at times a daunting environment?
Yeah, I think it's really important to think about that. I mean, on the flip side of that coin, of course, there are the things that also put us at risk, and how we can kind of buffer those or mitigate against those is really important to consider. But I would just agree with everything that you've said there in terms of kind of the protective and promotive factors. And sometimes we default, right, to looking to the problems. And there are lots of problems that we actually, as a society, as communities, can help to chip away at or solve. But there are also a lot of things we can be building in that are more protective and promotive.
So adolescents are in school a lot of time, right? My daughter leaves for school at 7:30, sometimes doesn't get home until 7 o'clock.
Right.
They're there a long time. They're with teachers, they're with counselors, they're with theater directors, etc. How should and how can teachers and parents work together on these factors that promote mental health and mental well-being?
I think thinking about having open lines of communication so we can share observations, right? Like I've noticed that your student is falling behind in cases where maybe they were really on top of their work, or we've observed these behaviors or concerns about maybe a student's being bothered by another student that they wouldn't necessarily share with parents. But how do we open up these lines of communication and make sure that parents feel like they're part of the team and teachers feel comfortable sharing that, like, this is what I've observed, to the extent that we can avoid any value-laden language. I think that's going to be really helpful. But they're, like you mentioned, they have their eyes on students for more hours almost in a day than parents generally do, especially when we think about school-age children. So I think that's going to be a key. And then also just, like, how do we build those relationships and how do parents support and honor those relationships, but then also how do teachers kind of serve as a supporting role? Because one teacher can make such
And you bring up a
difference.
great point about this school piece, in the kind of worlds of the research and the literature that we're invested in, there are whole frameworks that talk about how we really develop and how we develop within a social ecology, and that our family, we as individuals are kind of at that center, and of course our families are really a very important part about the way that we develop in all areas. But schools are kind of within a system that is, very side by side with the family. Sure. Not to say that by any means they don't override the family, but there is a lot of time. You just can't avoid the fact that there's a lot of time, and that the school experience is a learning and developing experience. That's the whole purpose of going to school. And so there's a lot that they're observing and socially and learning. And then we also are kind of within not just our family or the schools that we go to as people or as youth, but in their communities more broadly, and then certainly at the very higher level, right? We can't take ourselves out of that. We're not in a vacuum, right? We're all kind of impacted and influenced both in a positive way and sometimes in a negative way by the things that are going on around us. So really, I wanted to name that kind of explicitly because that's something that I think a lot about, that you think a lot about, but not everybody does, right? So when we think about our audience that might be here and isn't really in this space, it's important to really think about that importance, because as we kind of continue to talk about what are other factors that relate to mental health and what can we be doing with schools specifically, you have to kind of, I think, have that lens in mind. So thank you for raising that point.
So when we'll shift gears to barriers to mental health here in a second, but you mentioned COVID in one of your earlier answers.
Yeah.
Love to hear about what your thoughts are on how COVID has intersected perhaps with some of these factors that promote mental health. You mentioned sense of belonging, for example.
Right. Yeah. So, I mean, the COVID-19 pandemic, in some ways, there are very good reasons to believe what it did is just shine a light on a problem that was already there. And in other ways, it has absolutely exacerbated others. So the belonging is one that you bring up immediately. I mean, human beings, we are wired for others. We're wired for community, relationships, connectedness. And the impact of that disconnection from other people is just, it's very real and experienced by all of us, all of humanity, really, around the world. And so, when you talk to teachers and administrators and families, everyone kind of agrees, that's time lost, especially for our younger folks. And you could think across the spectrum of development of all the important things that are supposed to happen in your social life from 5 to 18, and all of that missed time. So, that is one major stressor. But then, of course, the COVID-19 pandemic also brought other adverse childhood events, or ACEs, as people call it, into people's lives at greater severity and more widespread. So economic issues, loss of job, loss of family. I mean, the numbers of people in our society that are not touched by maybe death or severe illness or long COVID it's expansive, right? And so, all of those then bring in these, unfortunately, these ACEs into kids' lives. And we know that all of those things, loss of a close familial tie, again, that comes back to relationships, of course. The economic, we know that, being raised in poverty puts kids at more risk, not being able to know that your basic needs are being met, right? And so when we think about another thing that helps people really thrive or flourish on the really positive side, you have to have your basic needs met, that you feel safe, that you know where your next meal is coming from, you feel connected to other people. And so COVID-19 really kind of hit into this issue around mental health in many different ways.
Yeah. And Jodi, in the introduction, I mentioned your Wellcheq app. So you have the benefit of, this is an app that students fill out every day, telling their teacher how they're feeling, right? So you have the benefit of data sort of pre, during, and post-COVID on that app, and you could talk about that a little bit.
Sure. So that was something that was really interesting. We launched during COVID unintentionally, right? It was just like how everything came together. And one thing we learned was that it really helps adults learn about challenges that students were facing that they wouldn't have expected. So, for example, a student wasn't logging on, but then she was able to use the platform to share that she was a very diligent student, but just like wasn't able to get internet access. And so they were thinking about how can we support her in this. Other students were not showing up, and then later kind of identified as experiencing depressive symptoms. And so it just is trying to break down this barrier, because what we're seeing is that a lot of students were really reluctant to ask for help, especially on a Zoom setting where you can't necessarily pull somebody aside and say, can I talk to you later? And there is the chat, but it's just a very different kind of dynamic. And so, and then we are starting to see like a little bit of a positive uptick, but the first year back was very difficult. And we noticed it was fascinating to see, but January, I think it was January 22. So there was this big resurgence of Omicron, I think, in like November, December of 21 leading into 22. And January was a very difficult month for our students. A lot of them identified with some of the less positive emotions. There was a lot of anxiety, sadness, loneliness, fear. And I think part of that was because people couldn't do the holidays the same way that they were hoping to. And it's already a difficult time, but it was really interesting to see that we've definitely seen some of the ebbs and flows, and that was notably a difficult time for students.
And that actually coincides with some of the national estimates. There were concerns and data like coming out for the CDC or the National Institute of Health, Centers for Disease Control, National Institute of Health, or NIH, that there are some estimates out there that there's ideas that the depressive symptoms and anxiety might have doubled during COVID-19. For our youth.
And eating disorders, too. That was something that you might not expect because it doesn't feel like it aligns as clearly with some of the other issues. But I think it's a sense of control, like students looking for something to kind of hold on to, and that often can look like an eating disorder. I also want to circle back to a point that you were saying, is that these trends, COVID certainly exacerbated them and made them like almost explode. But we've seen these trends happening for the last 20 plus years for a number of reasons. And some of which is thinking about those community connections and how they've subtly kind of been breaking down because of technology and other kind of just like structural changes that we've all experienced. And so I know that that's been a big part of your work. So I thought it was worth talking about because this is like at the fever pitch, but it's been brewing for a while.
Right. Yeah. I mean, I get involved with it's very specific activity around mental health surveillance. That's like that public health lens of how do we have knowledge about what's happening for our society, and our Centers for Disease Control takes that on so many different areas. Certainly mental health broadly. I work in the space of autism, and we see those numbers. So they are rising, right, and have been. And so, I think there are some that are more easily tiable to something like COVID-19 when you think about higher rates of depression and hopelessness in a time where there was a lot of uncertainty and a lot of concern about health. Yeah. That is makes sense. Even the eating disorders, which are often based in anxiety, higher rates of anxiety, feeling less in control of things, that could exacerbate something like an eating disorder, use of substances. So those things are interrelated. But certainly when we just think about mental health more broadly and kind of across different disabilities, we see that there's a rise, and that has nothing to do with COVID, and it's been kind of happening. And some of it is a good thing. It's probably was always there, and we just know it now. We have more people, more parents who feel empowered or understand the landscape of when to ask for help.
Right.
We have more people seeking access. We have more people noticing, whether that's a doctor or a teacher, we're doing better, and we're getting better access. And that also interrelates with some of the barriers too, which is knowing what is just compromised well-being versus a disorder. When do I ask for help? When do I get my child help?
Yeah.
These are hard questions, and that intersects a lot with stigma. You know, a lot of people feel like it's a failure of character or a failure of something if they can't get this under control, either of themselves or as a parent, and really trying to work to destigmatize the way we wouldn't blame a diabetic for not being able to control their sugar, that we wouldn't look at a person and say, why aren't you working harder to not be so sad? But that's, you know, that's part of all of us, I think, is sometimes it's easy to see the symptoms or the behaviors of children as deliberate, or that they're not doing what they should be, and not really recognizing there's something under that. Where is that really coming from? And so I think we're moving in many ways, but there's a lot of stigma that still exists out there, and that's a major barrier to getting accurate numbers and getting people the help they need.
Sure. So we've talked about some of the barriers already to mental health, diagnostic, adverse childhood experiences, sense of belonging, obviously. What about genetic links?
Well, you know, a lot of our disorders that you can name do have some level of heritability. It's a mix. I mean, it's not that if I as a parent have autism, then my child definitely will, or anxiety, but there are it's kind of a mix. And if you look at the data on very specific disorders, that's generally the theme you find, which is it's partially our genes. There are environmental factors that play into mental health, both in a very literal sense of like toxins in our environment that might be leading to higher rates of, say, like autism specifically. And then there's other aspects of what we're experiencing, like coming back to that kind of idea of ACEs. If you think about mental health truly as a continuum, it presents itself differently. So we're kind of all on this line of, say, no symptoms to severe symptoms. And you can imagine a world in which, like, I might have been born in the middle, but experienced things that mitigated that for me. And I never get to that point of a disorder or a diagnosable, named mental illness. And another person who might have started lower, but experiences a lot of things that kind of put you over that tipping point, if you will, right? And so, like that, I could think, I mean, this is a little bit outside of the box of what typically psychology thinks about, but not all disorders are going to be necessarily stable and look exactly the same throughout life.
Yeah.
Certainly when we think about anxiety, depression, people can seek very effective treatments that might, while you'll always know that you're a person who can suffer from depression, you might not be experiencing it in the way that impacts your life in a negative way all the time because you've managed that disease. In the same way, somebody who has a physical health problem, something like high cholesterol or diabetes, also can find medical ways to manage it. You don't not have it anymore, but you certainly aren't living that experience every day.
There's also, I imagine, equity challenges in diagnosis,
Yes,
right?
absolutely.
Who's getting diagnosed?
That's right.
And how does that play out? And I'd like to hear how that plays out potentially in schools as well.
Yeah, there are a lot of equity issues. Right now, if you look at how and where people actually get care for mental health, our access rates are pretty poor. Youth, about 1 in 5 say are suffering from some sort of nameable disorder, and about that same number might be getting any access to care. Our most prevalent place where we're seeing is actually in schools. And on the one hand, that's a celebration, and the other, we know that we're woefully understaffed in schools, and we don't have the kind of school mental health providers. Frankly, we don't have the mental health providers we need as a society broadly, in a clinical space, in a community space, or in our school spaces. So access is a real problem, and that's where you definitely see a lot of equity issues as to who can get access. Cost is a major barrier that then plays out, of course, with how much financial means you have. That's where schools can be a great equalizer.
I also think part of it too is like education around like what is mental health and what is mental illness and what does it look like. And I think that's also a challenge in that like more resource areas might have more information about that. They'll certainly have more providers. I know in a lot of our rural schools, it's hugely problematic. It's so hard to find a school counselor. In some places, they're like expediting certification processes and kind of doing limited training just because we need people who can help support students in this way.
And it's not just our rural schools, it's hospitals and medical providers. I mean, our rural environments in the United States are really at a disadvantage in terms of just the density with which they have access to anything, any of the different providers that might give that. You think about where we're based in Baltimore, and we're considered like a resource-rich area. We have many hospital-based systems. We have a lot of different behavioral health systems. We have one, Shepherd Pratt, that's like the largest behavioral health system in the country. I mean, and we have the Kennedy Krieger Institute associated with Johns Hopkins University, of course. I mean, we have so many, and they still have wait lists and lines out the door. You
As do
hear
universities.
Exactly. That's exactly right. So when you think about our rural environments, they don't have university-rich environments. They don't have these other built systems and infrastructure for mental health. And then there are other elements, like I said, coming back to stigma, where then there's also that layer too, and there are differences across different groups in our country where stigma looks differently. And then higher rates of stigma, lower rates of access to care, even if it is available.
So if we're lucky in a school, for example, there might be one school counselor for every several hundred students. That's right. That's the number we're kind of shooting for, right?
That's our goal.
Right.
But in many schools, that's not the case. We're talking about 500, 600 or more students per counselor. So in those schools, Jodi, talk a little bit about that challenge, how that changes the role of the teacher, how that changes the role of the principal, how that changes what parents can expect.
Yeah, I think it's such a big challenge because right now schools are faced with doing so many different things, including addressing mental health. And when you have a counselor for 500 or 600 middle school students who are already at a very vulnerable time, it becomes impossible to meet those needs. And one thing we think about is like, is student mental health issue a school issue? And the reality is it has to be because mental health issues are coming with students to school in all certain kind of ways, shapes, and forms. So we see it with behavior, we see it with achievement, attendance. When students aren't feeling well, it's hard for them to thrive academically. We just saw that with the NAEP scores a year or two ago. And attendance, we know right now we're having a lot of issues getting students into buildings. So, but it does change the role of principals and teachers and in ways that perhaps is unfair, and like I would argue maybe unfair. It's just we just need more adults keeping eyes on students, following up with them, checking in with them. Teachers talk about how they wear all these different hats of like mentor and coach and advisor and of course instructor, but then also kind of social worker, and like how do they help address these needs that they're seeing in their classroom that they can't not address because they come up and they permeate the walls. So it is a really hard issue, but I think the bigger societal question is like, how do we support schools and fund them better so that they can address these issues? Because the issues aren't going away.
And I think people hear a lot about violence in schools, right?
Yeah.
And maybe you could talk a little bit about how mental health issues are related to violence in schools, violence among adolescents, et cetera.
Sure. I think we see that. And it's interesting because it's this dynamic relationship in so far as when students are not feeling well, they're less likely to be able to regulate themselves. And so they're feeling angry, they're more likely to respond in a way that could be violent. And so we can't say necessarily that mental health causes violence or perpetuates violence. It's more just our students who aren't feeling well are just having a greater difficulty regulating themselves, especially in a space where you have a lot of other people and bodies and you don't necessarily have as much physical space as you might want in a cramped classroom. But we are seeing a lot of violence, and that also kind of circles back to that loneliness, depression, sense of community and belongingness, as unfortunately we know from so many of the incidences where there has been some kind of like violent episode with shooting, a lot of those students felt ostracized by the community and felt unseen and unheard. And so all of these things are so closely related, which is part of why mental health, it's almost a safety issue in some ways, and that's why schools are investing a lot of energy and resources to the extent they exist to address it, because mental health will influence everything, and we want our students to be as safe as they can be.
Well, and then the other side, unfortunately, when we talk about another adverse childhood event or trauma and stressors, as we continue to see a gun violence epidemic in our society, and it's certainly impacting our schools, the level of stress and anxiety that provides to people in school buildings, not just our youth, our teachers, our administrators, the people that are working in these buildings that now worry that they're working in an unsafe environment. So it's, that's another area where that is introducing, when I say that there's like a lot of different things that play out, and the COVID-19 pandemic contributes some of them, but we certainly are not without many others that continue today. And you just think about the broader context of our society, it's become more complex to navigate, right? The world is more complicated now than it was 100 years ago or 50 years ago.
And I think what we're seeing among young people too is this like deep-rooted frustration that like how many gun lockdown drills do they have to do? How many stories do we have to hear about shootings in schools before they feel like policymakers are doing things to make them safer? I think there's this deep-rooted like hopelessness and frustration because they feel like their voices aren't being heard, their safety's not always being considered. And I think we see that both with school violence and gun violence, and also actually the climate too. There are a lot of young people who are very worried about the climate, as they should be. Perhaps like they're seeing more storms, they're having more localized issues, but also this existential threat of like, what will the world even look like, and can we all survive it? And so it's this it's like you were saying, Elise, it's this multi-layered issue of feeling hopelessness and not heard, which contributes to all of the other different stressors.
Well, I can appreciate the frustration because, of course, the ALICE training, the lockdown drills, et cetera, are not addressing the fundamental issues, right? And we do know that there are actually interventions that can help schools and can help adolescents do better.
And unfortunately, we often go in the wrong direction. We think about like hardening the spaces even more, but when we put our kids into spaces that start to feel like jail, that is not good for well-being. And there's research that shows that. And so, really kind of taking that step back in public health, we talk about kind of I like continuums, and so does public health. So there's a continuum of like prevention to treatment, right? And this idea that we can always be preventing something, whether it's preventing anything that's nameable or problematic, like preventing any compromised well-being, or even just preventing further impairment from something that we're facing, right? And so I think when we think in that kind of continuum space and we think about schools, it's like, well, where are we going to put our energy into? How do we get the widest reach for the most people in the way that's going to be the most helpful? So sure, now we know that we have kids universally in schools and we can teach them all how to engage in a lockdown if something dangerous happens in our building. But is that really the best way that we can be spending our space? Or could we instead be shifting and helping to support their well-being, providing them with tools for that, whether that's coping and resiliency, helping them to become more connected in that school environment, feeling seen and heard, even if you don't feel heard in your society, if you feel heard in your immediate community or school, that goes such a long way. I mean, some research just shows that having just one caring adult can really shift the trajectory of the way a kid develops. And that caring adult could be, it often is, a school-based person. But how do we create an environment in the school building that allows that to emerge?
Yeah. And if you think about what you were talking before about a foundation, right, and a hierarchy right, of needs. That's right. That foundational sense of belonging, knowing someone's trusting you, knowing someone that you trust and can share with, and who hears you in a school, that can be a big factor.
And sometimes policy really helps. Like during COVID-19, we universally just had meals for kids, right? Because we just, as a society, decided that this is a time for real economic problems. So here's a policy that can just support kids in a non-stigmatizing way, and that can go a really long way. So what are the other things, what are the other levers we can be pulling that really impact people broadly? I think that's where we need to be starting to think.
And I think it's challenging from a policy perspective because, of course, during COVID, we did things for children to make sure they had food, to make sure they weren't in poverty. We saw poverty rates decrease among children, and yet we're pulling those policies away
That's
in a
right.
post-COVID world.
And funding for schools.
Right, the ESSER funding was great because you had investments in mental health and counselors, and now they have to take away some of these jobs and funding and other tools and things that folks are using to support students. And it's so hard because it's going to be a long fix, right? It's not just a year of having another counselor, it's sustained investment in student mental health.
Yeah. This sounds like an incredibly challenging environment to be a school leader, to be a teacher, to be a parent, and engaging with these issues around the mental health crisis. Do you see in your research, in your work with schools, do you see some schools and some practices, some interventions that are particularly promising right now?
I see a lot of shifted mindset. I've been in the Department of Mental Health for my whole faculty career. And in school psychology, even in my training, it was always this push to try to get schools on board with mental health. And you alluded to that earlier too, that sometimes it feels like a rub. But what I will say that I think is really promising is the mindset has changed. It's no longer, we can't do mental health because we have to do academics. There's a broader appreciation and understanding that these are inextricably linked. You can't just say, like, come here today, we're going to learn math and nothing else, like, leave everything else about what your life brings in at the door. I think there's a broad recognition in education. Certainly that money federally helped a lot, but it's now creating a lot of challenges for educators and thinking about how to redo it, but I think the mindset has started to change. And that is a really important aspect in terms of creating a space for new practices to emerge.
And that's what we're seeing a lot in the Wellcheq world, which is really exciting, as we no longer have to like sell folks on like why student well-being matters, which is great. And that's such a wonderful kind of change in shifted mindsets, and also just kind of phenomenon to start seeing is that there's so many educators and school leaders and district leaders and teachers, but I would say that they probably all of these parties have been concerned about this for a while, but I interact with a lot of the leadership and they're really concerned about this, which is exciting because hopefully that means that resources and support will follow.
Yeah. The work that our educators that walk into these buildings every day to do is, in my mind, nothing short of heroic. And I think that there is so much that is promising, and it's, with my public health lens and hat on, I think the issue is just scalability. Like, how do we really get things out to scale where all schools can kind of be impacted? How do we get into the communities that are struggling the most, have the most resources, have been the most demoralized historically? Like, how do we get there and make sure that everybody's needs are being met? But I do think there is a lot of promise to be working and building on.
Well, this has been a great conversation, and it's just the start. We hope that you'll join us next week for the second part of our conversation, and we look forward to answering your questions then.